may be wondering what the clinical part of CRNA school kind of looks like in the day-to-day practice. And my name is Anna. I'm a first rotation junior, and today I just did 2 neuro cases. We have to hit case minimums in lots of different categories. Those categories include things like the type of surgery itself, so like hips, knees, backs, spines, hearts, lungs, things like that. And we also have to hit numbers in things like procedures, so nerve blocks, central lines, arterial lines, things like that. I'm in my first rotation and at a anesthesia group that rotates between like 6 different facilities. And right now the expectation and the hope is that I'm going to get all of my thoracic, cardiac, neuro, crani, and also like pediatric cases. Oh, and OB. So today I just did 2 spine cases. I just finished those 2. And those spine cases are like very involved, and it's a lot of coordination with the OR team. And I'm definitely still learning like the flow and the balance of all of that. Just looked and I've done 18 like spine cases so far. I have some more that I have to hit before I've hit my bare minimums. But one of the cases was like an anterior and posterior fusion, which means like I intubated in the bed, and then the first part of the case was done anteriorly, and then we coordinated with the entire OR team halfway through the case after they've already closed the anterior portion to flip to posterior. So it's really cool to work with the team that's like so involved, and then everybody like really works really, really well together, because that's so much communication to flip a patient prone in the middle of a case. On the spine days, those are days I definitely always want to get a second IV, and I also have to get 100 IVs in CRNA school. Unfortunately, all the IVs that we do as bedside nurses don't count. So I've done 56 IVs, and I've got a lot more IVs to go. Tomorrow is a thoracic day, so I've got a lot of reading and review to do specifically on the patient, but then also about management of thoracic cases in general. So I want a Diet Coke and a little snack before I get started with case prep for tomorrow.